Hello, my name is Simon Hayes of Hayes First Aid. We're going to look at this short video on how to do a risk assessment. This video will come in two parts. This one will look at things you need to consider, and then part two will look at what high risk and low risk environments need to do in terms of first aid. During this we will make reference to the first aid needs assessment, the first aid bulletin from June 2016, and leaflet 74 from the HC. First of all, let's look at what the law requires. The law requires an employer to provide first aid equipment. This is basically your requirement to provide a first aid kit in order to render first aid to your employees who become injured or ill at work. The law requires you should provide suitable people as adequate to provide first aid to those injured or ill at work. This is basically your requirement to provide first aiders, and as it states, these should be suitably trained. The law says as an employer you are required to make a first aid needs assessment. This is a legal requirement, and this video will help to guide you through the process. So things to consider as part of this assessment. First of all, you need to consider inexperienced workers. These have the possibility for more potential for injury due to a lack of experience in the task that they are doing, so we need to consider these people when we're doing the assessment particularly. We have to consider workers with disabilities or health problems. The first aider should have the ability to deal with these problems such as asthmatic emergencies, diabetic emergencies, or angina attacks, although there may be other conditions that we have to consider. We have to consider employees who travel or work remotely. These have to be thought of when you're doing the risk assessment, but it normally means that you have to provide a suitable first aid kit and a means of raising the alarm for them. We do have to consider premises spread out over several floors. Access to first aid kits and first aiders should be available in the shortest possible period. Guideline from St John's Ambulance last year said that should be around 1 minute. We're asked to consider workers who work at other employers' sites. Do you have a formal agreement with them to include them in the other employers' risk assessments and likewise in yours? We're asked to consider members of the public. Although it's not a legal requirement to provide first aid for them, we're strongly recommended to consider non-employees in our assessments. So when we look at the numbers of people we have on site, this should include non-employees, not just employees. Let's look at some additional training. These notes were mainly from the First Aid Bulletin of June 2016, but also from Research Council Guidelines of 2015. First thing to raise is the Automatic External Defibrillator, or AED. If you do have one on site and your personnel are expected to use it, then it comes under the PURE regulations and adequate training should be given in it. From December 2016, then an overview of AED use will be included by law in EFAW and FAW courses. This is something that we at Hayes First Aid have been doing for a number of months and indeed years now, and it's an overview but not a full AED course. Okay, catastrophic bleeds. There was a change in the guidelines recently, and this has been published in the June 2016 bulletin. That said that first aiders likely to encounter these catastrophic bleeds should be trained on tourniquets and hemostatic dressings. This is an optional bit, it's only on the FAW course, and it's aimed at those in construction, forestry, and some manufacturing sites. So if your needs assessment says that there is a likelihood of people coming across such injuries and having to deal with them, then you need to include tourniquets and hemostatic dressings in your first aid box and make sure that your first aiders are trained to use them. The way that you do this is by specifying that you require this training when you book their course. Okay, do you use hydrofluoric acid? Work in remote locations or confined spaces? The HC specifically mention this and say that specific additional training is required in these circumstances. So if any of those occur, then you must seek out additional training. The record of this assessment. First of all, there is no legal requirement to keep a written record of this assessment, although it's generally good practice to do so. Appendix 1 of Leaflet 74 is a useful way of doing this, and here is that Appendix 1. It includes a part not only for your first aid personnel, appointed persons, first aiders with EFAW and FAW, but also for additional first aider specific training such as tourniquets and hemostatic dressings or AED use. First aid equipment is also added there, so your normal first aid kit, if it has any additional contents or additional equipment, the use of the AED, any travelling first aid kits for your remote workers, and a first aid room. Okay, in part 2 of this, we'll look at what you have to provide in low risk and high risk environments.